Welcome to Healthy Body, Healthy Mind. I'm Dr. Scott McFarland. We all get headaches from time to time, but a migraine is anything but a simple headache.
Normal light now becomes painful light. Normal noise actually becomes unpleasant. Odors become unpleasant as well, or even touch. And this process can escalate and go on literally for days.
A migraine is just, it's horrible. I don't wish it on anybody.
It's unrelenting pain. There's no position one can get comfortable in. It's literally, absolutely miserable pain.
On today's program, we'll take a look at how migraines and cluster headaches affect patients in their everyday lives, see what type of treatments are available, and explore what can be done to help properly manage these often debilitating conditions.
Major funding for Healthy Body, Healthy Mind has been provided by Novartis Pharmaceuticals Corporation, whose mission is to improve people's lives by pioneering novel healthcare solutions, and by Amgen, a biotechnology company committed to providing novel therapeutics to address unmet medical needs in the treatment of cancer patients. Additional funding provided by Amylin Pharmaceuticals, Shire HGT, Avenir Pharmaceuticals, and by Zogenix.
Imagine headaches that have you searching for a dark, quiet place to hide. Imagine headaches so severe that sufferers pound their fist or even their head in anguish as they scream out for relief. If you can imagine all that, then chances are you know what it's like to live with migraines and cluster headaches.
A migraine is a severe debilitating headache which usually affects one side of the head that can be associated with moderate to severe pain and associated symptoms of sensitivity to light and sound. And during the headache, people prefer generally to lie down in a dark, quiet room.
Often, along with a migraine headache, come nausea and vomiting, and patients can become sensitive to any minor stimulation. Here's what happens inside the brain. A migraine begins when brain cells release various neurochemicals that cause inflammation and activate pain fibers on the surface of the brain.
If this brain basically gets overloaded, to put it very simply, it starts to create a chemical change in the brain itself. This begins to produce symptoms, and if the process isn't halted, eventually the nerves on the surface of the brain are activated to release chemicals that set up inflammation, and they cause blood vessels to swell, and in that process you start getting pain signals being sent back into the brain.
The Primary Care Network developed several music videos to help medical professionals and others better understand the symptoms of migraine and cluster headaches. There are different forms of headaches depending on the severity and pain. While migraine pain can occur anywhere on the head and alternate sides, a more severe type of headache, called cluster headache, typically involves only one side of the head. There are two types of cluster headache. The first type is what's referred to as episodic cluster headache, which is characterized by attack periods of 8 to 12 weeks, with remission periods lasting months or years. Patients generally go through cluster periods or cycles repeatedly through decades of their lives. Cluster can, unfortunately, also become chronic, meaning there are no periods of relief for over a year, often lasting many years. Cluster headaches are also known as suicide headaches due to the intensity of pain and, if not treated properly, the inability to stop them.
In migraine, the idea is to shut down stimulation to the nervous system. People want to go into a dark, quiet room. They want to turn off the lights. But interestingly, in the midst of a cluster attack, it's almost the opposite. People feel very agitated and they can't sit still. The pain is so intense, they've got to move. and they're pacing and you know, active. Sometimes they'll want to pound or rub their head or do something as a counter irritant to try to stop the pain.
I think it's probably one of the most severe pains known to humankind.
The headache of cluster is excruciating, and its total unpredictability and its unrelenting just night after night when someone's going through a cluster cycle can be totally devastating.
Research shows that migraine occurs about 3 times more frequently in women than in men, while cluster headaches are more common in men. The National Headache Foundation estimates that nearly 30 million Americans suffer from migraines, and patients are most often born with a genetic predisposition to them.
People with migraine are actually born with a unique nervous system. We know, for example, people with migraine tend to process sensory information differently than people that don't have migraine.
I usually picture it as a stick of dynamite with the word biology written on it and a fuse. Once the biology is in place, there are a number of factors which can act as triggers and light the fuse.
Some of the most common triggers include changes in weather, certain foods, smells, odors, or fumes, stress, sleeping habits, eating habits, hormonal changes in women.
The things that we can be careful about if we look for food and beverage triggers is that we can avoid them altogether, or we can choose when we're going to do them.
But not all the triggers of migraine can be avoided.
For me, lifestyle tends to be the biggest trigger of my headache. So if I don't eat well or sleep enough, if I am dehydrated, I get more headaches.
33-year-old Samantha Ash Godin, a graduate student at State University in New York, knew the pain she was experiencing was a migraine because both her mom and sister suffer from migraines. They began when she was 20 years old and have continued ever since, and she is well acquainted with the pain.
If I have a headache on a day that is like a bright, sunny day, I generally will take several precautions, and it sounds kind of funny, but I will always wear my contact lenses on a day that I have a migraine and that it's sunny out, because just wearing my glasses and having it touch my face makes it worse.
Hi, let's go. Hi, how are you doing?
Good. Even though I was in pain all the time, I didn't want to think that there was something really wrong with me. As I got older, the headaches would get worse faster, and I was getting them more often.
Beauty expert Grace Gold was only 11, just starting puberty, when she first began having migraines. During her high school years, Grace was always concerned about her migraines affecting her way of life.
In high school, I would get them about 3 times a month, and as soon as I felt it coming on, I said, oh no, because I had nothing at that point to treat it with. Sometimes this would happen on special occasions, and it was just always this feeling of dread, like, when is the next one going to come? And I hope it's not someday when I really need to be on my game.
Are those consistent triggers for you?
Consistent,
Consistent
yes.
triggers.
Yeah.
Okay.
Approximately 25% of migraine patients see an aura before a migraine attack, at least for some of their attacks.
The word aura means wind. It means a warning. And it's a neurological group of symptoms that may include changes in vision.
For me, it's like a little bit of spotty light, and I just don't feel right. It's hard to explain it, but I know when I feel this way, I'm going to get the headache.
The vast majority of people have migraine without aura. They don't have these warning symptoms, but they do have what's called a prodrome. Many people will begin to notice that before their migraine starts, for as much as 24 hours, they may have changes in their appetite, they may have changes in their mood, they may have changes in their sleep factor, and that can herald the onset of migraine.
The earlier patients intervene in the attack, the better the outcome. Treating the onset of pain can have a profound impact on reducing the intensity and frequency of the headaches.
Good. Well, tell me about headache, and we'll chat a bit about what's been going on with that.
Patients with 2 or 3 or more headaches per month should ask a physician about medications.
What we typically encourage people to do is to pay close attention to the early signals of a migraine attack, treat as soon as possible, and try to get the attack completely stopped if we can within 15 or 20 minutes.
It's very important for patients who have either migraine or cluster headache to treat as rapidly as possible.
A migraine is a disease that never sleeps, and those who suffer from them don't simply have to live through the attacks. Many people also have to learn to cope with the fear that comes between attacks. This fear is often caused by the growing uncertainty of when the next debilitating migraine will occur, which can be almost as exhausting as the migraine itself.
So, hon, how was your day today?
It was great.
Emily Jones was diagnosed with migraines when she was 21 years old. Now 27, Emily struggled for years thinking that she had no options.
You can't help it but wake up and think, am I gonna have another migraine today?
It's really frustrating to people that they can't plan their lives. A lot of people feel like their lives are out of their control or the headache has taken over.
Family and my husband, one, he has to take care of me when I have migraines. You got a busy day tomorrow?
Not really.
And, you know, sometimes it can be a burden, like if we have plans, it makes me miss work.
Migraine and cluster headaches are two of the most disabling diseases in the world due to the fact that pain and suffering accumulates year after year, decade after decade.
On a very bad migraine day, I would get hit with a wave of nausea first.
And out. Good.
And then I just feel tired and something's coming on and I just don't feel good at all. I was a straight-A student and they finally got so bad that one day I had to turn in something late. And that really freaked me out because I said, this is now really affecting my life.
There are generally two categories of treatments for migraine and cluster headaches: acute medicines and preventive medicines.
The acute medications are used to treat the headache when it occurs. Preventive medications are used to prevent headaches. They need to be taken on a daily basis.
The most common types of acute medications are nonsteroidal anti-inflammatory drugs such as ibuprofen, acetaminophen, aspirin, and even caffeine. These pain-relieving medications may temporarily ease the pain, but taken alone will not stop severe attacks. In the early 90s, revolutionary, highly effective medicines for the acute treatment of migraines, called triptans, came onto the market. Triptans had the advantage of being specifically developed for migraine and cluster headaches.
Triptans work on receptors in the brain as well as blood vessels within the brain. And by interfering with certain chemical processes that occur during migraine, they can quickly abort the headache, as well as the associated symptoms that can often accompany the headache.
The first triptans that were released in the United States were injection. And it turns out that the injectable form of sumatriptan is an effective and fast form of treatment for acute migraine.
We have to think about how we can get the drug in quickly, again, when the attack is already at its peak. And the way they work to stop migraine is by stopping the release of inflammatory substances that are released during an attack. They vasoconstrict vessels and they interrupt processing, pain processing.
If I take the pill and it hasn't quite went away, then I'll use the injection and it gets right in your bloodstream, so it helps pretty quick.
Samantha Ash Godin had been dealing with migraines for years, but was not prepared when 2 years ago she suddenly had a migraine attack in the middle of the night.
The first time it happened, I was kind of shocked, and I took the regular medication, the headache didn't go away. And I spoke with the doctor and I found that this was very common and they're also very difficult to treat.
When patients experience middle-of-the-night headaches, the best course of action is to use the injectables. This form of medication gets into the blood faster.
The rescue medicine for the middle-of-the-night headaches generally works very fast if I catch the headache early on. If I don't treat these headaches immediately, I know that I'm going to have a very bad experience.
Because of the nature of cluster headaches, generally only fast-acting medications work quickly enough to be effective.
The one difference is that patients who have cluster headache, because the pain builds up so rapidly and usually lasts shorter in duration than migraine, the delivery system is very important. And so medications that are given either via an injectable or a needle-free system that provide rapid relief are generally the medications that cluster patients seek.
It's very, very important that the right medication is prescribed for the right reason for the right person. So if the right reasons are if people have migraine, whether with or without aura, or they have cluster headache, triptans are very effective. Now in cluster, some of the nasal spray and the injectable forms are really the preferred route because they're a very short, rapid headache.
Patients who have several headaches per month rely on preventive medication to reduce the number of migraines or clusters. These preventive medications decrease the sensitivity and hyperexcitability of the brain.
I would say probably 4 or more per month lead you to think about preventive medication, or even if they have fewer attacks per month but are not responsive or for various reasons can't take acute medications.
Many of the preventive medications have in common their ability to prevent some of the initiating factors that start the migraine. These preventive medications include cardiovascular drugs, antidepressants, anti-seizure drugs.
Every day I take a preventative twice a day, and I take a beta blocker as well as an antidepressant. And I don't take it because I'm depressed, but just the chemical it works with in your brain also helps migraine patients, or can if it works for you. A year ago when I started this, I had 15 migraines a month, which was the worst of my entire life, all the way to exactly a year later on this routine has got me down to 2 last month, which was the best month of my entire life.
Preventive medications can reduce the frequency, severity, and length of migraines and may increase the effectiveness of symptom-relieving medicines used during migraine attacks. Your doctor may recommend that you take preventive medications daily or only when a predictable trigger is approaching.
One of the models of migraine care that is really important to me is called collaborative care. Migraine is a process. It is a management issue that people will do for decades of their life.
Collaborative care occurs when doctors actively engage patients in evidence-based decision-making and management based on what matters to the patients.
What we do literally is try to create a toolbox for people. And again, the foundation for the toolbox is education and knowledge. So if they have a migraine, for example, that awakens them and it's full-blown in the night, they may have to have in their toolbox an injection or a nasal spray that goes around the stomach.
You've got like a whole tool set there just to pick and choose what you need.
During collaborative care, it is essential to recognize that 2 experts are working hand in hand, the doctor and the patient. Together they work to understand and bring into play the tools and skills necessary to manage the headache attacks.
The goal is to get the right medicine and sometimes the right formulation of that medicine to the right diagnosis in the right person.
It can be challenging to cope with migraine and cluster headaches, no question. But by controlling triggers, taking effective medications in a timely way, and incorporating a few lifestyle changes, patients can stop feeling like their migraines and cluster headaches are controlling them and begin to improve their quality of life. Coming up, a warning about taking headache medicines too frequently. Plus, we'll take a look at non-traditional therapies for headaches that people can do at home.
According to the Journal of Neurological Sciences, migraine patients have a greater rate of depression and